Many men over the age of 40 continue to masturbate regularly. Some believe it helps maintain physical health, improve sleep, and may even support the prevention of prostate enlargement. But many others wonder, could doing it every day be harmful? Could it disrupt hormonal balance or silently damage the prostate? This question may sound simple, but underneath lies a series of complex biological reactions that few people pay attention to. The prostate is a small gland located just below the bladder. It's responsible for producing the fluid that nourishes sperm. Though it's only the size of a walnut, the prostate directly affects sexual function, urination, and overall comfort in the pelvic area. If not properly cared for, this gland can become congested, inflamed, or enlarged over time. In this comprehensive discussion, we'll examine 4 specific changes that can occur in the prostate when you engage in daily self-stimulation. All of these insights are based on clear biological principles and real clinical experience. Most importantly, understanding these mechanisms can help prevent issues that many men don't recognize until it's too late. If you're in your 40s, 50s, or beyond, this information could be crucial for maintaining your long-term health and quality of life. Before diving into the effects of daily masturbation, it's essential to understand what makes the prostate so critical to men's health. This walnut-sized gland produces approximately 30% of the seminal fluid that carries sperm during ejaculation. The prostate contains smooth muscle fibers that contract during orgasm, helping to expel semen through the urethra. The prostate is also rich in zinc, which plays a vital role in immune function and tissue repair. As men age, zinc levels in the prostate naturally decline, making the gland more susceptible to inflammation and infection. This is why maintaining proper prostate function becomes increasingly important after age 40. The gland is surrounded by a network of blood vessels and nerves that can become compressed when the prostate enlarges. This compression can lead to the classic symptoms of benign prostatic hyperplasia, BPH, frequent urination, weak urine stream, difficulty starting urination, and the feeling of incomplete bladder emptying. Many people ask, if daily masturbation is supposedly problematic, then why does the body continue to crave it so regularly, as if it were a natural reflex? The answer lies in how the prostate responds biologically, not emotionally, but mechanically. Mechanism 1. Hormonal regulation and DHT cycling. When a man reaches orgasm, the level of DHT, dihydrotestosterone, hormone in his blood temporarily drops. DHT is a powerful hormone that helps maintain male characteristics, but it's also a primary contributing factor in prostate enlargement when it remains at high levels for extended periods. Regular ejaculation creates short hormonal breaks, giving the prostate relief from prolonged DHT stimulation. This temporary reduction allows the prostate tissue to recover and prevents the continuous growth signals that DHT provides. However, if the frequency is too high, constant hormonal fluctuations may destabilize the endocrine axis, affecting the body's natural testosterone production, especially in men approaching andropause. Research has shown that men who ejaculate regularly have lower baseline DHT levels compared to those who abstain completely. This suggests that moderate, consistent activity may help maintain hormonal balance rather than disrupting it. Mechanism 2. Vascular health and blood flow. Optimization beyond hormonal factors, ejaculation also involves intense muscular contractions in the pelvic floor and the prostate itself. These movements help improve local blood flow, boost cellular metabolism, cleanse tissue, and nourish the gland with fresh nutrients and oxygen. When blood circulates well, the prostate tissue stays elastic and resists the hardening that often accompanies aging. The rhythmic contractions during orgasm act like a natural massage, helping to prevent the stagnation of prostatic fluid that can lead to inflammation. However, if the pelvic muscles are overstimulated without sufficient recovery time, this can lead to chronic tension, fatigue in the pelvic area, and reduced urinary control, particularly as men age. The key is finding the balance between beneficial stimulation and overexertion. Mechanism 3. Immune system modulation. The prostate maintains its own localized immune activity. Under normal conditions, dead cells, excess proteins, and biological waste are partially expelled through ejaculation. This natural cleansing process helps lower the risk of mild chronic inflammation and removes potentially harmful cellular debris. When ejaculation occurs regularly, it prevents the accumulation of inflammatory compounds that can trigger immune responses. However, if the body doesn't have enough recovery time between cycles, internal immune responses can become dysregulated. As a result, prostate tissue may experience persistent low-level irritation, causing a dull heaviness in the pelvic region, even when medical tests and scans show no obvious pathological cause. Mechanism 4. Neurological adaptation and stress response. The fourth mechanism involves the nervous system's adaptation to regular sexual activity. The prostate is innervated by both sympathetic and parasympathetic nerve fibers. Regular ejaculation helps maintain the balance between these two systems, promoting healthy stress responses and overall nervous system function. During orgasm, the body releases a cascade of neurochemicals, including oxytocin, prolactin, and endorphins. These substances not only provide pleasure, but also help regulate stress hormones like cortisol. Chronic stress and elevated cortisol levels have been linked to prostate inflammation and enlargement. Men who maintain regular sexual activity often report better stress management and improved sleep quality, both of which contribute to overall prostate health. The biological mechanisms we've discussed may sound clinical or abstract, but in reality, they've made a clear difference in the lives of many patients. Let me share a detailed case that shows just how much a small habit can impact the prostate over time. I once worked with a patient named David, a 65-year-old former construction site supervisor from Nevada. He came to the clinic complaining of frequent nighttime urination, waking up 4 or 5 times per night, a persistent feeling of incomplete bladder emptying, and a dull discomfort in his lower abdomen that had been gradually worsening over 2 years. David explained that he used to be very healthy, rarely sick, active, and energetic. But over the past few years, something felt fundamentally different. He said he didn't feel like himself anymore, experiencing fatigue, irritability, and a general sense that his body was failing him. As we dug deeper into his history, I discovered that for nearly 10 years, David had completely stopped all sexual activity, including masturbation. After his divorce at age 55, he had convinced himself that that part of life was no longer important or appropriate for someone his age. He was also deeply embarrassed to discuss sexual matters, viewing them as too private and awkward for medical consultation. The physical examination revealed several concerning findings. His prostate had enlarged to approximately 45 grams. Normal is typically under 25 grams for his age. His PSA levels were elevated at 6.2 kgm/L, and the digital rectal exam showed areas of firmness and irregularity. The prostate ultrasound confirmed mild enlargement with some heterogeneous areas, suggesting chronic inflammation. While these findings weren't immediately dangerous, they clearly indicated that David's prostate was responding poorly to years of neglect. We developed a comprehensive treatment plan that addressed multiple aspects of his health. The plan included dietary modifications, reducing inflammatory foods, increasing omega-3 fatty acids, regular light exercise, 30 minutes of walking daily, increased water intake, targeted supplements, saw palmetto, zinc, lycopene, and most importantly, the gradual reintroduction of regular ejaculation, starting with once per week and adjusting based on his body's response. David was initially skeptical and embarrassed about the sexual health component of his treatment. However, once I explained the biological mechanisms and framed it as essential medical maintenance rather than a recreational activity, he became more receptive. After 4 months of following this protocol, the improvements were remarkable. His PSA levels decreased to 4.1 kgm/L, his nighttime urination episodes dropped from 4 to 5 times to 1-2 times per night, and the chronic pelvic discomfort nearly disappeared. The follow-up ultrasound showed reduced inflammation markers and improved tissue texture. Even more significant was the change in David's overall well-being. He reported better energy levels, improved mood, better sleep quality, and renewed confidence in discussing health matters. During our 6-month follow-up, he told me something I'll never forget. I never imagined something this simple could change both my body and my mindset so dramatically. I wish I had known this information years ago. One of the most frequently asked questions is, how often should I masturbate for optimal prostate health? The answer isn't a fixed number. It depends on your age, overall health status, recovery capacity, and individual physiological response. Here are evidence-based guidelines developed from clinical observations and recommendations from leading urology experts. Men ages 40 to 49 can typically maintain a frequency of 3 to 4 times per week. At this stage, hormone levels remain robust, recovery is generally quick, and the prostate responds well to regular stimulation. However, pay attention to your energy levels and any changes in urinary function. Men ages 50-59 should consider reducing frequency to 2 to 3 times per week, depending on individual health status. If you experience fatigue, changes in urinary patterns, or prolonged recovery times, reduce frequency and monitor your body's response carefully. Men ages 60 and above usually benefit from 1-2 times per week to maintain circulation, promote natural cleansing, and preserve biological rhythms. If your overall health is good and libido remains active, twice weekly may be appropriate, but avoid consecutive days to allow adequate recovery. Special considerations. Men with existing prostate conditions, those taking medications that affect sexual function, or individuals with cardiovascular concerns should consult with their healthcare provider for personalized recommendations. The most crucial principle is consistency rather than frequency. Avoid long periods of complete abstinence followed by periods of excessive activity. This habit should complement proper rest, balanced nutrition, regular physical activity, and routine medical checkups to maintain optimal systemic health. Beyond the physical aspects, there's a significant psychological barrier that prevents many men from maintaining proper prostate health, shame, and embarrassment around sexuality in later life. The truth is, most men don't lack information. They lack the comfort to discuss and address these sensitive topics openly. Masturbation, after age 50, is neither wrong nor shameful, and certainly not something that requires secrecy. However, due to cultural pressures, religious upbringing, and societal judgments, many men choose silence over health. This psychological barrier often leads to complete neglect of prostate care. I've encountered numerous patients who recognized something was wrong but were too embarrassed to seek help or ask questions. They viewed ejaculation in older age as unnecessary, inappropriate, or even strange, especially when done alone. However, once these men understood that regular ejaculation is simply part of basic male health maintenance, similar to exercise, proper nutrition, or dental care, their perspective shifted dramatically. The shame dissolved when replaced with medical understanding and health-focused intention. What I hope you take away from this comprehensive discussion is not just numbers or another health tip, but genuine awareness and empowerment. Your prostate doesn't need to be ignored simply because discussing it feels awkward. It requires attention, care, and consistency, just like any other vital organ in your body. Understanding these biological mechanisms empowers you to make informed decisions about your health. Whether you're 45 or 75, your prostate deserves the same attention you give to your heart, brain, or any other crucial body system. The 4 mechanisms we've explored, hormonal regulation, vascular health, immune function, and neurological balance, work together to maintain prostate health throughout your life. By respecting these natural processes and working with your body rather than against it, you can maintain better health, comfort, and quality of life as you age. Remember, taking care of your body isn't just for the young. It's for those who understand themselves and commit to staying healthy from within. Your prostate health is an investment in your future comfort, confidence, and overall well-being.